And Anita. We have some time for questions. If you'd like to ask some questions, I want to ask a question. Stephanie, you talked about how important muscle mass is, and I've seen several publications coming out lately, and maybe Dr. Lee can respond to this as well, on the importance of exercise. So can we infer from the nutrition information and from the recent publications then that that exercise and muscle building is going to help patients do better? You can go ahead.
Yeah, so definitely when I meet with patients, and we talk a lot about muscle because we see that helps tolerate treatment. So the one aspect of it is the protein intake, so making sure you're hitting enough protein to stimulate muscle synthesis. But exercise is absolutely key. That's a great question, and I'm glad you brought it up because I think it's not always talked about enough in this setting, because we know that specifically resistance exercise does help with stimulating muscle growth. So, checking with your doctor what's safe for you to do, and then trying to find a way to incorporate that to help you, build back muscle if you've had muscle loss, or even work on maintaining it, I think is really crucial for anyone with a diagnosis of cancer, definitely.
Yeah, I agree. I think there is more research coming out on the importance of exercise. So I think there's two aspects. One is just your physical fitness and health, and being able to keep up your functional state, your performance status. So, and if you look at the guidelines on cancer fatigue, actually, I think the best evidence is exercise, which is counterintuitive. People think, well, I'm on chemo, I'm tired. But there have been some randomized trials where if you actually keep exercising, you tend to reduce the fatigue because you're maintaining your physical fitness and how much you can tolerate chemo. I think there's also some interesting data that whether or not physical activity during chemotherapy might improve the efficacy, and I think that's people are looking into that, maybe because you're improving your circulation or other biological effects. We're not sure. I do know there was a large randomized, I think it finished accrual, but we're still waiting for the results. There was a large randomized controlled trial in colorectal cancer, randomizing patients to an intensive exercise program or not. And so I think we're waiting for the results of that. And they are going to look at not only just outcomes of physical fitness and quality of life and symptoms, but they're also looking at outcomes like recurrence rates and survival. So I think it looks very promising. And like you said, I think you have to, when you're on chemo, I think you have to work with somebody, probably, better to work with a personal trainer who has like certification in oncology, so you know what's the right balance. I mean, you can't overdo it. I've had patients like running 10, 20 miles and they're losing weight, and I'm like, well, it's because you're probably exercising too much. So you're just trying to balance it out.
Thank you. Looks like I just want to say one thing. We'll get right to you. Anita, bless you, because being a caregiver is not easy, and those meals, holy cow, you are a lucky man. Yes, so wonderful, wonderful. Okay.
Right here. My name's Paige. I'm a nurse practitioner at Johns Hopkins. I have a question for Stephanie. I spend my time telling a lot of patients what not to do that they've looked up in terms of different diets. And I agree very much with the plant-based, the whole plant-based diet. The challenge that I have is that fruits, vegetables, things of all, the rainbow colors don't have a high calorie content. And so patients, I say the stomach is precious real estate, that they can't eat very much, they eat small meals frequently, but eating lots of plants, veggies, what have you, they're missing out on high calorie food. So was wondering what your suggestion is in terms of small amounts that are high protein, high calorie dense.
Yeah, that's a great question, and something that I deal with patients as well. You might feel full and only eating a small amount, and what I focus on first is if people tolerate them, to focus on plant-based forms of high-calorie foods. So maybe things like avocado or adding olive oil to those vegetables, doing nut butters, things in a more easily digestible form so that it's going to be digested more quickly in the body so you can eat something a few hours later. And then, of course, as I mentioned before, there's balance in what we're eating. So, there is room for other high-calorie foods as well. If you're losing weight, I think priority is, again, treating that malnutrition. So you might have times in your treatment where you're eating more foods that aren't from plant sources. The other thing that can really help is modifying the plant foods. So similarly to what she was discussing with all her amazing meals for her husband, you can make a smoothie out of fruits and vegetables, and that's really going to break up the fibers and make it easier to digest. And you can mix that with high protein foods and with some of those plant fats to make a really nutrient-dense smoothie that can help you. You can also try just chopping them, cooking them, making them easier to digest, doing more, comfort preparation like stews and soups and things that are easy to eat when you don't have a lot of energy. So there is a balance, and again, there might be times during treatment where you're not even supposed to be eating a lot of fiber if you've had a recent digestive surgery. So you might have a little bit of, am commonly working with patients, so we need to adjust the type of fiber, the preparation of fiber. So the goal is always where you can get them, try to find the form that sits best for you. It's a great question.
Hi. My mother takes natural mushroom supplements to help with her side effects from chemo, like lion's mane and turkey tail. Have you heard of any contraindications of that with chemo? Or have you heard of any studies of that before?
So the question's around mushroom extracts or supplements. So there are some studies of mushroom extracts, and when I was at Case, I ran a small laboratory. We actually been studying mushroom extracts, including from turkey tail, shiitake, and other sources. So I do think there is some interesting data. Most of it comes out of Japan, where they've actually done prospective randomized controlled trials of mushroom extracts. There's particularly one, actually it's not made anymore, that was a Trametes versicolor, a turkey tail base, showing some benefits in colorectal and gastric. So I think it looks very interesting. Most likely in my own research and others have demonstrated that these mushroom extracts don't really have any direct anti-cancer effects. So if you put it in a mouse model, and we've done this in our lab, that has no immune system, it doesn't do anything. It doesn't do anything in cell culture. But as soon as we put it in a syngeneic model of cancer that has an intact immune system, it does seem to consistently reduce the growth, so it's probably immunomodulatory. But what I would say is that I don't think there's enough studies to date to know which mushroom extract to use, lion's mane, reishi, shiitake, maitake, there's so many. And I will also tell you that in our studies, we were looking at different doses. We actually found that a low dose consistently increased the growth of the cancer, versus higher doses seem to decrease. So we were a little bit shocked. Actually, when we first did that study, I told my lab tech to run it again. This doesn't make any sense. But he ran it again, it was exactly the same result. So, and there is a phase 1 study done at MSK on a maitake extract. And if you look at that study, the mushroom extract has different effects on different types of immune cells. So some immune cells are stimulated, some are suppressed. At different doses, it seems to have different effects. And so at very high doses, it seems to maybe could even be immunosuppressive. So my advice for my patients who ask is if a patient's on chemotherapy, I don't recommend it. One, because I don't know if there's an interaction. Is it going to, a lot of these are metabolized to the liver. A lot of chemotherapy is metabolized, is that a good idea in a patient with cholangiocarcinoma that already has altered metabolism? So I don't know. Two, I really don't know which mushroom extract to use and at what dose. The other thing I'll tell you that we started looking at, a colleague of mine said, well, what happens if you start it and stop it? And we actually found intermittent dosing might be even better than daily dosing. So I think there's a lot of things I just, personally, there's a lot of things I just don't know about it. And so, especially in cholangiocarcinoma, because it hasn't been well studied, I would be hesitant. If I have a patient with colorectal cancer or gastric cancer, for which there is a randomized controlled trial, I feel a little bit better about, thinking about it, but I never do it during the middle of chemo, and I would definitely not do it during immunotherapy. I think there could be, it could go either way. So we are interested in doing studies. Our next set of studies is to combine it in a mouse model with immunotherapy to see if it enhances. I will tell you that my colleague at Case, who's studying a beta-glucan, which is thought to be the active ingredient of mushrooms is beta-glucans or certain types of glucans. They did a study where they combined it, and actually the animal model did worse. And she kind of glossed over it in that she was presenting it. I said, could you go back to that slide? Are you telling me that the PD-L1 plus your beta-glucan did worse? She's like, yes. And I said, well, that was weird. And she's like, yes, we're trying to figure out what happened. Right? So I think we just don't know, right? And so there's a lot of unknowns. So I think this is one of those that I think is very interesting. It's worth more study. I know that there is a beta-glucan in clinical trials, and I know people are looking into it, but today I think it's too risky. In different, if you were a cancer survivor and you said, hey, I finished and I want to try to prevent it from coming back, that might be a different scenario, but during chemo or any kind of active treatment, I would be very cautious. And so I would just eat mushrooms, just like a lot of fruits and vegetables, although it's not truly a vegetable, but I don't think there's any harm in you eating a lot of mushrooms. So you want mushroom soup and shiitake and maitake and portobello, go ahead.
Can we go back to Heidi? I think Heidi's, do you have a question, Heidi?
Yes.
Then we'll come up here.
First of all, I want to thank you because it was all very informative and helpful. My question is about alkaline water. We have several places in our town, and they tout all the health benefits, and they talk about it very helpful to cancer patients. And I just want to know what you think about alkaline water.
So I'll give my take. I don't know if you want to chime in as well. So alkaline water is kind of similar to the alkaline diet that I mentioned in my presentation. And I also have a lot of, people that I work with that choose to drink alkaline water. And it's similar where we don't have studies showing that it's going to provide benefit, but at the same time, I don't think there's a lot of harm to drinking alkaline water. And if that's what tastes better to you when you're getting chemo, that's absolutely okay. But it can also be expensive. So it's definitely not something that we have evidence to support that you should only drink alkaline water. So it's kind of a patient-specific thing. If you like it, it makes you feel better, you can incorporate it. But not a lot of data behind it to show it having a benefit in the body. And I kind of talked a little bit about the pH balance in the body too, so the same would apply there too.
Okay, thank you.
Okay, go ahead, and then we'll take the two questions back here, and then we need to wrap this session up. Thank you.
Dr. Lee, real quick, what are the qualifications and certifications you look for in an acupuncturist? Also, at what frequency would one need to do, in other words, visits, before you start seeing some kind of results? And then finally, totally off subject or a different related, but cannabis, medical marijuana. I know you didn't mention that, but I'm sure there's a lot of questions about that as well.
Yeah, I was debating whether or not to put a cannabis slide. I thought, I don't know if I have enough time, but someone will probably ask. So I think cannabis is a hot area of research right now. Actually, I have a study in R21 from NCI looking at cannabis to see if it can treat chemotherapy-induced peripheral neuropathy. So I think cannabis, there's data. There's an Institute of Medicine kind of overview indicating that there's enough data to say cannabis could be potentially helpful for things like pain, appetite, nausea, muscle spasms, especially multiple sclerosis. There's some indications for seizures in certain indications. So I do think there's enough data to say it can be helpful from a symptom standpoint. And people often forget there's Marinol, which is a FDA-approved THC, which is approved for appetite and for nausea. So if your state has it available, I think it's a reasonable option. There's very, very little data on CBD. It's it's highly marketable, but very few studies. So I think the data there is probably maybe around anxiety and sleep. It might be helpful, but I think we need more research. As an anti-cancer agent, I would say there's very, very little data to date in terms of its anti-cancer benefits. And quoting from my colleague who's at UCSF, where California has had it legal, he's like, someone asked, and he said, I've been in California for 50 years, and I still have yet to come across a case of somebody, having anti-cancer effects. He's like, there's so many people in California using it, I think I would have seen it by now, and he hadn't seen a single case yet. So I think that's a good, not as scientific as but a reasonable data point. So the other question was acupuncture. So you need to make sure your acupuncturist is certified nationally. There's a national licensing, and there's usually most states have a state licensure. So at a minimum, they have to have both of those. You would prefer somebody who is at least willing to work within a Western healthcare system. And the reason being is that usually when I've had acupuncturists within my own team, I ask them to check blood counts, like, are you neutropenic? Do you have low platelet count? Are you on anticoagulation? These are kind of things they need to know so that they can modify the acupuncture technique. And so hopefully they have some familiarity within a kind of a Western system and are willing to communicate with your oncologist. There are certain times where after surgery, they shouldn't be acupuncturing near their surgical site and some of these basic things. So I think those are the kind of things you want to look for, some of that's probably working with your other medical providers, ideally.
Go ahead.
Hi. First, thank you for all the information. It's pretty amazing. and you're going to get another cannabis question. So there's a retrospective study about cannabis and durvalumab. Do you know of any current studies going on or any more studies about the relationship between the two?
So with durvalumab, you mean immunotherapy?
Yeah, the immunotherapy being less effective when using cannabis.
I think that could be real. They're asking is that, there's been some analysis now that cannabis use during immunotherapy could be harmful. And a couple of publications have indicated there could be a decreased efficacy. I think that's real because, so if you understand the biology of cannabis, right? So there are CB1 receptors and there's CB2 receptors. CB1 receptors are, are one of the most prevalent neurotransmitters found in the brain and CNS. CB2 receptors are actually primarily found in the periphery on immune cells, right? And, cannabis is thought to have an anti-inflammatory effect. And so my personal thinking hypothesis, although I would say it's more speculative, why are there CB2 receptors on immune cells? It probably has an anti-inflammatory effect. And if you're using a lot of cannabis while you're in immunotherapy, it's kind of like taking steroids in immunotherapy. We know high-dose steroids will decrease your efficacy of immunotherapy. So I would generally avoid cannabis, during immunotherapy because of that risk. I think there's ongoing, people are trying to collect more data around this to know for sure, but I think there is a potential harm there.
Okay. Thank you.
I'll make my 2 questions quick. I've been taking green tea every day since I heard that green tea was supposed to be good for your liver, and now I see hepatotoxicity on some of these presentations here. Is it good for you?
So the questions around green tea. So the hepatotoxicity that has been reported is specifically the patients who take very high dose concentrated green tea supplements. And so it's been demonstrated that especially on an empty stomach, the liver probably can't handle the metabolites and it causes damage. So I think it's perfectly fine to drink green tea. So if you want to drink 2-3 cups, not a liter or 2, but a couple cups a day. But I would avoid green tea supplements, which could be very concentrated, and then unfortunately could lead to some liver toxicity.
Okay, thank you. Real quickly, what do you think of protein supplements such as Premier Protein, Orgain?
Yeah, so protein supplements definitely can have a place. As you've heard, the theme is food first, so if you're able to tolerate protein-rich foods, that's usually where we start. But there's a lot of times where proteins aren't appetizing, or maybe the plant proteins are higher in fiber, it's hard to get enough of them. And as I talked about, muscle mass is so key. So I do use protein supplements. It's going to vary a lot individual from person to person. I'll often recommend if there's like a plain unflavored protein powder that you can mix into things. But for shakes on the go that are an easy option, if you're going to be spending a couple hours in infusion, they can be good options. And my general rule of thumb is look for one that has high protein. So I'd say at minimum 15 to 20 grams of protein, and then looking for one that's generally low in the added sugars, just again to help reduce the total intake over the day. So it depends a lot on what somebody can tolerate, whether a higher calorie or a lower calorie shake is important, but I think they can be really good tools to help somebody maintain protein intake when foods are a little bit difficult.
Thank you very much.
Thank you, Stephanie, Richard, and Anita. Fantastic, and I think they'll have so many more questions for you. We're so grateful you're here. This is one of the main topics of interest for patients when they first come to the foundation. They want to know how to handle things, so thank you so much.